thank you guys for all coming out tonight. And again, I appreciate that. There's so many people sitting in the front row. You're like me. In school, I used to try to sit in the back row, but I figured I would get less distracted if I sat in front. The title of my talk tonight is Let's Get Chiro-practical. My name is Dr. Linnea Soular. I'm a chiropractor at Grand Itasca, located practicing over at the professional building. Reflecting back on why I became a chiropractor, I realized I've taken many paths as a patient benefiting from care, beginning as a child for a sports-related injury, then as a high school athlete to prevent some of those minor problems, those aches and pains from becoming larger ones, keeping you out of playing and practice. And then to optimize my performance, to recover from a work-related injury then in my 20s as a young working adult. And then to help with those common problems that happen during pregnancy. Then in my 30s to heal from a car accident and some of the soft tissue injuries that I sustained. So after this process of undergraduate school, getting a bachelor's degree in exercise and sports science, I worked for a few years as a personal trainer in health and fitness, wanting to just promote wellness, help give people tools to better help themselves. Trying to figure out what the next step would be, I decided that chiropractic was a really good fit. And I graduated from chiropractic school at Northwestern Health Sciences University in Bloomington, Minnesota in 2005. So my first couple of experiences as a clinical intern, I got to practice caring for expecting mothers, for infants, for children, for a practice that was filled with families seeking care. And my second experience, I got to be in a practice where I got to use my adjusting skills on athletes, on marathon runners, police officers. I even got to adjust through a bulletproof Kevlar vest. It's possible. I didn't think so, but it was an on-duty cop that he was so desperate for relief, he couldn't take off all of his equipment. He set his gun next to the table, and it worked. It helped. I even saw visual proof of a man who had Jesus in his heart on an x-ray where he had forgotten to take off his rosary necklace, so it looked like he was in his heart. So that interest in health and wellness, as I mentioned, drew me to this profession it's interested in reviving your body's ability to heal. So my objectives of my talk tonight are to talk about what is chiropractic care, what are some of the benefits of care. Then, of course, to talk about, there's lots of myths out there. I'm sure a few of you have some. I've heard them before, maybe even said them. So we'll try to dispel some of those common myths I hear all the time. And then let's talk about, what about stress? What about our posture? How does that affect us? And lastly, I want you to leave tonight with some practical tools, some things that you can do, some exercises that can help. So chiropractic care, it is a hands-on, drug-free and non-surgical approach to healthcare that focuses on the structure and then the function of our musculoskeletal system and our nervous system, affecting general health. Your brain is in charge of everything that's happening right now, allowing us to see each other, for you to hear me, for you to feel the clothes that you put on, and giving you signals that start from that brain, going down the spinal cord, along your nerves, and then to parts of your body. Your organs, your tissues like your muscles, the fascia, that spider web interconnection that holds those muscles together, and your joints, which move our body. And those messages travel back up along that pathway, back up the nerves, through that spinal cord, that's so important that it's completely protected by a column of vertebrae, of bones. And then back up to the brain. And then information flows back and forth, and it works really well until it doesn't. So chiropractic is a board licensed, national and state licensed healthcare profession. You're required to complete undergraduate work similar to pre-med. In fact, my husband, Dan Soular, is a family practice medical doctor, and we found comparing our first 2 years of schooling were very similar. And I was very lucky to be able to save some money on the cost of books because he already had them. A little double dipping. We're trained to take the thorough medical history to diagnose and then provide care for neuromusculoskeletal problems. So because the hands-on skill are required, early on there's emphasis placed on that education to detect and correct spinal subluxations. I'll get to the definition of that in just a little bit. Each state board licenses the scope of chiropractic practice, but generally also includes providing physical therapies, advice on nutrition, exercise, self-care, and lifestyle factors. So what is that big word, spinal subluxation? Sub meaning less than, luxation meaning less than a dislocation of a joint. So stressors, we experience them every day in life. They're common. Some people would even say that stress is just a normal everyday experience. Stressors are received through our nerves, as I mentioned, that we experience life through our nervous system. Stress causes those nerves to cause muscles to tighten, which pulls those spinal joints out of alignment, irritating nearby tissues, nerves, soft tissues, the fascia, that interconnected web, that spider-like, keeping all of our body parts moving and smoothly connected. And it results in pain or dysfunction. Any asymmetry in posture is a sign that there's a problem and might be related to recurring back or neck pain. So an exam often includes just a brief assessment of your posture, how you hold yourself against gravity, the factor that doesn't ever change. Pain and limited movement as we watch you bend and turn are common reasons that patients seek chiropractic care. A severely crooked posture can indicate scoliosis or long-standing spinal distortion. So problems that start out earlier on in life and may not have been corrected. All right, so let's talk about the prevalence of some of these reasons that people seek out chiropractic care. Pretty prevalent in that 65 million people in the US alone endure back pain every year. Raise of hands here. I'm going to get a little audience participation, and here's the first opportunity. How many of you here, just raising your hand, have experienced back pain? There's a few that didn't. How many in the past year have experienced back pain? So it's pretty common. And up here, it talks about statistics show that 80% of Americans suffer spinal pain sometime during their lives. Low back pain is the most common disability for people under age 45. Does that surprise anyone? Yeah, it kind of surprised me at first, but then as I thought about it and I thought about my practice, it really didn't. So chiropractic care is the most common alternative health care to traditional medicine. As we talked about, 80% of Americans have experienced chiropractic care. Now I'm curious to see out of this group, how many of you have ever been to a chiropractor by a show of your hands? That's a really good group. I'm glad you guys showed up tonight. So over half of US adults have been to a chiropractor. Despite the harmful growing epidemic of prescription drug overuse and abuse, another common treatment for neck and back pain. So in 2017, the American College of Physicians has issued a guideline. You know, a guideline is this is what you do, this is what the best practices are recommended. And that guideline states that conservative, non-invasive care is effective treatment in the first-line approach. You know, those methods would be including things like massage, applying ice, heat, exercises, stretching, strengthening exercises to move our body, and manipulation, so spinal adjusting for low back pain. Before drugs. That's before an over-the-counter prescription, aspirin, Tylenol, ibuprofen. So let's talk about the safety. Chiropractic spinal adjusting overall is a very safe treatment for musculoskeletal neck and back pain. And once determined, you're an appropriate case for care, and that's where the complete history and diagnosis needs to happen. The most common side effect is muscle soreness, and that usually lasts just a short time, maybe up to 12 to 48 hours after care. And it's similar to what you would experience after exercising or maybe overdoing it in the garden. Other common treatments, such as non-steroidal anti-inflammatory drugs, as I mentioned earlier, surgery, or even prolonged bed rest, pose a higher risk of treatment. One study that I didn't put up here, but did talk about in the American Journal of Gastroenterology, approximately 1/3 of all hospitalizations and deaths related to gastrointestinal bleeding, so stomach bleeding, can be attributed to the use of aspirin or NSAID painkillers like ibuprofen. Yeah, that's actually higher risk to take aspirin or NSAID painkillers like ibuprofen than narcotics. And those are the over-the-counter things that anyone can grab. So, what causes you to seek care from a chiropractor? Stress, as I mentioned, is a normal part of everyday life and a very common culprit of spinal subluxation. So taking a look at this picture up here, how many sources of stress can you identify? How about physical stress? Let's start with, what are some physical stressors? Lifting. Sitting too long.
Vacuuming, scrubbing floors.
Yeah, too much housework. Vacuuming, scrubbing floors, absolutely. So bending, twisting, absolutely. Someone said sitting. You've probably heard the comment that sitting is the new smoking. And we'll get to that a little bit later in the presentation. Gardening, yeah, so that bending over, and it's something you just do a few times a year. How about, let's take a look at emotional stressors.
Marriage.
I mean, there's a picture there.
Not your marriage.
No, that one.
Yes. Marriage can also extend your life, though, especially better for men than women, so that could be a positive stress as well. So emotions like fear, grief, anger, anxiety, yeah, those emotions, they have an effect on our body. We feel them, right? Your chest tightens, or your heart races, or you clench your teeth, the shoulders creep up and you'll lose your neck. So when someone's unhappy, you can tell by looking at their posture, right? It shows. You can tell if a friend is feeling down by the way that they carry themselves. Their body's tightened up. And then those weakest spinal joints in the body can become misaligned because of that stress. Let's go on to the third type of stress, the chemical stress. So go ahead and shout out some of the common chemical stressors or ones that you see up here on this photo.
Coffee?
Yeah. Too much caffeine, alcohol,
Drugs.
Yeah, drugs, smoking, absolutely. Tobacco abuse. What we eat, what we drink, products we put on our body, and the air that we breathe, the quality of that, all can affect our overall health. And it can start sending alarms, getting our attention. And I think stress can be a different definition for everyone too, because if you just don't have the physical ability or the emotional capability to tolerate or adapt to those situations, then you're going to start to feel the adverse effects, right? If you're someone who 80% of the time eats well, gets good sleep, is active, then 20% of the time when you decide to stay up late, eat junk food, and not exercise, you're going to be okay, right? So chiropractic care, it can't eliminate these stressors that happen in life, but care can enhance your ability to deal with it, to adapt, to cope, whatever words you want to use. So, talking about sitting. Many people sit an average of 13 hours a day. So, I'm not a mathematician, but 24 hours in a day, an average of 13 hours sitting, that doesn't leave you with many hours. If you add sleeping in there, Dr. Stephen Weininger, he explains in his 31-day posture month public health initiative that was just in May. Had we talked about this a month ago, I really could have got you connected with some good resources. But he has a website, and it's called www.posturemonth.org. And there's 31 days of simple posture improving tasks on there that you could still go online and find. Just don't sit while you're doing it. Stand up and hold your tablet up here. So poor posture causes neck and back pain, as we talked about. Your muscles, your ligaments that hold you upright, they weaken, and your lungs are compressed, restricting your ability to take a deep breath. So let's do a little test here. Here's your time to exercise. So just sitting where you're at, I want you all to sit and pretend like you're typing an email on your computer, or maybe sending a text message on your phone. And I want you to take a deep breath in and just notice how much breath do you get in. What does it feel like? What parts of your body does it get to? All right, everybody did that? Okay, so now let's sit really tall here. Tall posture, head reaching towards the sky as if a balloon were attached, pulling it up. And I want you to try to take that same, hold on, let's go back a couple more steps here and give you a little more direction. So draw that head up, shoulders come up, and then drop them down and back. So you're open through your torso. Now take that same deep breath in as you keep those shoulders down away from your ears. So notice how much breath can you get in? More, absolutely. More oxygen to your brain is going to help reduce stress. It's going to improve your mental clarity, and it's going to give you more energy. Who'd like more energy? Anybody? Absolutely. So that's a little tool that you can use as a reminder to, draw that head up, lengthen your spine, open your torso, those shoulders down and back, so you can get full breath in. But not all stress is bad. An example would be a runner who experiences that release of those chemical endorphins minutes into a run that create positive feelings of accomplishment and self-confidence. Now this leads to the first of some common myths that I hear often in practice and want to dispel. The first one is, getting adjusted is going to hurt. Why would I want to do that? So the truth is, most patients will say that adjusting experience is much better than they anticipated. That fear is greater than the actual experience. That quick release to your spine often produces a spontaneous relief, or that improvement can take a few days up to a few weeks. Myth number 2. Now, I know some of you have said this possibly, but I'm afraid of the sound of my bones cracking. So the sound heard isn't actually your bones cracking, right? But it's like popping or cracking your knuckles. That quick shift and stretch in that joint, it releases pressure. Tiny little gas bubbles that make that sound, kind of like opening up a bottle of pop. Releases the pressure from the carbonation. It can be loud, it can be quiet, it can be several, or it can just be one big sound. The amount of sound does not equal the quality of the adjustment, nor the severity of the subluxation. It's just noise, and I wish I could use a remote and mute it so that you can instead focus in how your body feels, what those changes are. So let's talk about some of those benefits of chiropractic care. So there's a nice list here, and we could probably add a few more. Stress reduction, pain relief, an increased range of motion in our joints and body, relaxation of tight muscles, and improving posture. You may find that you're able to complete those home and work tasks easier, like the vacuuming and the gardening and the sitting at the computer. More energy is a common benefit of care. And this is one that not everyone thinks about, is that better concentration and mood. I often hear man, I feel better. And now that I don't have that static noise causing that distraction and that pain, I can concentrate on what I need to do. My brain's not being pulled away to try to get rid of that annoying pain in my neck that I felt all morning. Patients of chiropractic often say that they sleep more comfortably, and then care can also slow that wear and tear, degenerative aging process. So who can benefit? Anyone interested in a safe, effective approach to improve their ability to adapt to the stresses of life. Children can benefit. We tailor the care, obviously, to the size of the individual. They can benefit as infants, maybe suffering from some stress during that birth process. Being born it's a stressful process. Even a normal, natural delivery is pretty stressful, tight squeeze out. So often infant subluxation happens at that first entry into life. And then think about how many here are grandparents? How many times have you seen your little ones learning how to walk, fall, smack dab on their bottom, get back up, and do it again, and do it again, and do it again? I think about when I fall on my bottom, it doesn't feel so good anymore. And then as an adolescent or a teen, often have parents bringing in their kids saying that they're complaining of growing pains, their legs hurting, their hips hurting. Well, oftentimes we can find that there's some issues that chiropractic care can help with, and they don't have to suffer through that as a normal aging process. Poor posture is a common thing you see in teens, right? Parents are always saying, stand up straight. And then just injuries that happen through playing sports, playing on the playground, and then stress of their deadlines, their school and home environments as well. And adults, repetitive work, recreational injuries, pregnancy. It's very common to experience low back, hip, even neck pain and headaches during pregnancy, and chiropractic care is a safe alternative. There's not a lot of other options because medications aren't safe during pregnancy, most medications. Surgery isn't an option because the problem is just temporarily there, and soon that problem comes out. But caring for children, frequently bending, lifting, breastfeeding, all of those things can place strain on a woman's body. Motor vehicle accidents, several soft tissue injuries, neck sprains and strains that can benefit from chiropractic care, and that early treatment is so important to prevent that spinal degenerative process, arthritis, from occurring. People suffering from chronic pain can often benefit under chiropractic care. And then again, I had to put stress in there. So, myth number 3. Once you start, Doc, I don't want to start coming to the chiropractor because once you start, you have to keep going. Anyone heard that one? Yeah. For the rest of your life, possibly, but it's always up to you. Care recommendations are going to be based on your problem, based on your goals, and I always tell people how long you want to benefit is always up to you. Like other good habits, like regular exercise, good nutrition, and regular dental care, many choose, once they feel better, to use chiropractic care as a way to maintain that health. So this slide shows the levels of how far you can decide to take your care. As I said, it's entirely up to you and your goals, and we'll partner with you to help you in whichever way you choose. So initially at the bottom, patients will come seeking relief. They will say something like, I want to feel better for the least amount of my time and the least investment of my money. And this usually will occur, within days to a few weeks. Over the next few weeks to a few months is when correction happens to stabilize and retrain those muscles and ligaments of your spine that had been injured in the first place. After that, regular chiropractic care can be scheduled to maintain preserving that progress that you made, or can even prevent problems from reoccurring. It's a lot easier to keep and stay well than it is to get well. And then the last way to benefit from chiropractic care is where you receive care not for a problem, not for an injury, but because you understand that importance of spinal health to your nervous system and you want to optimize your health and well-being. You want to perform at the best possible you. So, chiropractic care is a partnership. How quickly you respond can rely on factors, some that are out of your control, like age, past injuries, but many healthy habits and behaviors that you take can determine how quickly you might respond. So some suggestions are drinking plenty of water, eating healthy food that gives you nutrients to fuel and heal, exercising regularly, getting enough good quality rest, practicing good posture. There's that term, posture, again. And also attending to spiritual matters, whether you pray, meditate, but that mind-body connection is very, very powerful. Making sure that you make time for relationships and connecting with the people you love. And then remaining open and having a positive attitude that there is hope for healing. So everyone knows that people lose height as they age. But did you know that your life can get shorter as you get shorter? The physical restriction of your lungs and your abdominal organs caused by the loss of height causes a much greater risk of heart disease, stroke, and respiratory mortality, is what studies have shown. These are just a few informational snippets that are found on that posturemonth.org website I mentioned earlier. So if any of this information interests you, I'd suggest that'd be a good place to go and read them. But people who spend 12 hours or more per day seated are at greater risk for diabetes, heart disease, and life-threatening falls. And on top of that, poor hunched over posture makes you look older. And who wants to get older before our time? So be aware of your posture in daily life. Look to see, are you using good posture when you lift, when you sit, when you exercise? So as we've talked about, 1 out of 4 adults will suffer back pain in just the past couple of months. So the next slide here talks a little bit about strong balance and a strong core are key to moving with confidence and avoiding injury and back pain. And here's some really interesting information, I thought. Standing up means using 640 muscles to balance, 206 bones, while not pinching 45 miles of nerves. That's a lot of nerves. So when someone says, you're getting on my nerves, send them down the road a few more miles, right? Or 60,000 miles of blood vessels. That's a lot of interaction that needs to happen. Down here it says 1 out of 3 adults over 65 fall every year. So balance training can significantly reduce your fall risk. Take action to improve your posture. Exercise like yoga, specific strong posture exercises recommended by chiropractors, physical therapists, and your physician. Exercise regularly, and Pilates. Studies show mindful meditation and focused exercise can improve your function and reduce pain better than pain medications. And that goes back to the guideline that came out this year in 2017, that here's where you start. And then working out with funky form, let's say you have some of those postural distortions that you can't undo with exercise and good posture and yoga or Pilates. Working out with funky form can undermine your function and performance, opening the door to injury. So professionals will assess your symmetry and improve your motion with focused exercise, chiropractic care, physiotherapies, muscle therapy, and massage. This last slide here of the effects of posture on aging talks about how you can influence your environment. First of all, being aware, taking some action to control, and then being posture smart, putting an end to some of these bad habits. So the first one is to sit strong, to optimize your work, home, and exercise environments to align each of the posture zones. Getting your feet underneath your hips and pelvis, lined with your shoulders, and head over those points. Those 4 points that you should look for optimal posture. We talked about sitting restricts breathing and circulation, so get up and move often. I find it helpful to use phones or timers or a computer to set like an hourly reminder to just get up, stretch, drink some water, move, go to the bathroom, whatever it takes just to get you moving. Then standing taller. So we talked about on average people sit 13 hours a day. On average people are active only 4 hours out of 24 hours of the day. So to improve your posture, walk more and choose good footwear that is comfortable and supportive. Not always the cutest, but functional. So one tip you can use is check the soles of your shoes and see what kind of wear. If there's even wear, or if you're having an uneven wear, might show some signs of postural imbalance. And then lastly, you can control your environment and how well you sleep soundly. People sleep an average of 7 hours a day, and I'm not so sure about that one. I feel like that should be lower. Might have some really good sleepers that sleep more, because I don't hear a lot of people sleeping much more than 7, maybe 8 hours a day. So I get asked a lot, what is a good mattress, what's a good pillow, and it can be a personal preference. Usually medium to firm mattresses are best. However, it depends on the individual. You might find something a little softer, and then you have to adjust your pillow. So it's a combination of the pillow and the mattress. How should you sleep? On your back, on your side, or on your stomach? On your side, yeah, see, you guys are smart. Never, ever, ever, ever sleep on your stomach. Get there, stretch, and rotate onto your side or your back. Side sleepers, it's a good idea to try to place a pillow between your knees and your feet, your ankles, so that it keeps your pelvis from rotating while you're sleeping, and I'm maintaining that neutral posture with your feet underneath your hips, in line with your shoulders and your head. If you're on your back, you want to try to put a pillow underneath your knees to keep a little bend in there so it's not straining, pulling on the back muscles, and that you've got adequate support for that curve in your neck. So try to select a pillow when you're in the store. Get out those pillows. Put them, if you're mostly a back sleeper, behind you, and see if that's going to keep your ears in line with your shoulders. Or if you're a side sleeper, put it underneath the side of your head and see if that keeps that space of your spine in line with the rest, your neck in line with the rest of your spine. Sometimes people will choose a pillow that's too high, leading your head to be in this position for several hours, or too low, meaning that you kind of tuck that hand up underneath. If you're one of those people that find yourself like propping your hand underneath your pillow, it's probably not plump enough. You want to find that Goldilocks pillow, right? The one that's just right, that keeps you in line. So let's get to some daily practical tools here that you guys can use. So audience participation time again. So if you want to choose to stay seated, you can. Otherwise, go ahead and stand up. And we're going to practice standing and sitting tall. First of all, I want you just to relax and try to pull that head up towards the ceiling and breathe. Okay, we're going to start by grounding our feet. So I want you to go up on your toes, rock back on your heels. Let's try to spread those toes out a little bit. And then set the four corners of your feet firmly down in contact with the ground. So your weight isn't too far forward on those toes, putting strain on your knees, nor too far back on your heels, putting strain on your back. All right, so now take a deep breath in as you're grounded through your feet. So the next posture zone, as we work our way up, is going to be to center your pelvis. So I want you to arch that low back a little bit, extend your spine, and take a deep breath in. Okay, so now arch that low back, breathe in, and gently pull that belly in, tucking your pelvis under slightly. And breathe out. So go ahead and repeat that again. Arch your low back, breathing in, pulling that belly in as you tuck your pelvis under you slightly, and breathe out. All right, got that? Relax, don't get too stressed. Next up, let's try to open our torso. So I want you to take a deep breath, lifting the shoulders up, draw them back and down as you breathe out, holding those shoulders in place. So I like to think of this like pinning those shoulders to your back by turning on those back muscles. These are those muscles that hold us upright and fight against gravity that's always against us. So let's do that one again. So lift those shoulders as you breathe in. Exhale, rolling the shoulders down and back, keeping them there as you take a second deep breath in. And then lastly, let's lift that head. Look straight ahead in front of you. Lift your head from the base of your neck, trying to lengthen that spine. And here's a common thing that I see people do. I see them jut. As they lift their head, they extend, jutting that chin. You want to keep it a bit tucked. If you have a hard time lifting from the base, that tells me those neck muscles at the base of your neck are pretty darn tight. It probably feels good to do this stretching. All right, so look straight ahead. Breathe in and out. Lift the base of your head, slightly tucking that chin to lengthen your spine, and repeat. And that's it. Easy, right? It's practice. So ground the feet, tuck the pelvis underneath you, shoulders come down and back, and lengthen, lifting that head level with that chin slightly tucked. All right. Good job, you guys. Go ahead. You can have a seat.
That's hard work.
Yeah? It gets easier. If you figure out, these muscles that we use to stay up tall, they have endurance. And the more that we can build good habits, it builds that endurance, right? So another practical tool that I recommend to all patients to do is some form of self-massage. So it can, working out that fascia, I mentioned that, connective tissue. You've probably gone to the grocery store and bought a piece of cut up meat and seen like an iridescent kind of clear film that goes over the meat. That's your fascia, and we have that interwoven between our body too. It serves to reduce like the friction as you're repetitively moving, and it also helps muscles and body parts to move smoothly together. But oftentimes it can hold tension and stress and be more difficult to get rid of than improving the flexibility of one muscle. So issues can stay in those tissues. So find some way every day to roll that out. There's a picture up here of a foam roller. If you work out here at the YMCA, I know that they have them over in their stretching area. They might be white or gray. They come in a variety of colors. You can also use like a pool noodle, one of those swimming long noodles. It's a little smaller, not quite as nice to use, but take that, put it up against the wall, so it would be going the length, and then you're going to lean back against it, and then just bend your knees and stand back up so that it rolls up and down your back. You'll have to play around with where feels good to place it, but that pressure can be really helpful. Or you can lay down on the ground, putting it underneath you, and try to roll that way too, moving back and forth. It's a little harder, requires a little more core strength to do it that way, but pretty effective. An easier way might be to take a tennis ball or a similar ball that has like a little bit of a give to it, and you can use that to apply that same type of pressure. So if you're going to work out some of those low back muscles into your hips, you could take that ball, lift your cheek, slide it around underneath you there, and then find that spot that hurts so good and hold it there for a little while until it doesn't hurt so good anymore. anywhere from 10 seconds to a minute or two would be good. If you hold it really long, you certainly can create some bruising in your tissue, so don't be surprised if you see that after a length of time. One thing I like to recommend to people is to take like a long tube sock or a nylon old pantyhose that ran and you don't want to wear anymore, and put the tennis ball in the bottom, the toe of that sock. And you can tie a knot so it stays down at the bottom, and grab hold of the other end, slinging it behind you, and then you can go up against a wall and lean into that. Again, applying that same pressure, breathing through it, and releasing some of that myofascial or fascial restriction and tension. Who's done that before? Good, we've got some people. People in the back. And then lastly, in your handouts there, I included a handout titled Back in Shape and Pain-Free, with some exercises to help safeguard your back. So in the top paragraph there where it says passive stretches help facilitate movement in the affected muscle or joint, stretches should be held for 15 to 30 seconds, allowing the muscles to gradually relax and lengthen. You can either cross out 15 to 30 seconds or just add on that side. I want you to add the slow, deep breathing. So take 3 to 5 slow, deep breaths. If you were to take 3 to 5 slow, deep breaths while stretching, that would be approximately that same amount of time. But you're going to use that awareness to realize, how tight am I here? Do I need to spend a little bit more time? And then use that breath to get oxygen to those muscles to help them relax better. I find that when you tell people to do it for 15 to 30 seconds, they just count and they get there, and once they're there, they're done. So a little more of a mind-body awareness. So there's pictures here included with stretches you can try at home, stretches that bend you, stretches that extend your back. And then the back side has a few other more active stretches, or I'd even call them exercises, that can be helpful in strengthening your back. And then down at the bottom, there's a few tips there that you can read through. The resource for this was from the American Chiropractic Association, our national association. Again, another really good place for resource for information for patients, for the public, as well as for doctors of chiropractic too. A lot of good information about politics of chiropractic and how laws shape insurance coverage and that sort of thing. I found that in my 11 years in practice that the more that patients, that common people get involved and demanding that the care that they want, these laws start to change. You know, certainly in our profession, we can try to ask our local state senators and representatives to expand the coverage of chiropractic scope of practice. Oftentimes examinations or some of the other physical therapies, modalities, exercises instruction are not covered by plans like Medicare, Medicaid, and any other of the government plans. And then the major medical insurance plans will often follow what Medicare does. So if we want something to change there, we've got to speak up and ask for it. And that concludes my formal presentation. You know, if you're not moving the way you should, or if you're having pain with movement, I just ask that you don't suffer, seek some help. All right, thank you guys very much for your attention.